Hey guys, it's Jessie here. I wanted to do a quick video for you today to talk a bit more about the pelvic floor and specifically to address a question that I've been getting asked quite frequently lately, and that question is, how do I know if I have pelvic floor dysfunction that should be treated by a pelvic floor physical therapist or another specialist that treats pelvic floor issues? So this is a great question, and thank you so much to everyone that has been asking it, and hopefully the answers and scenarios that I go through today will help give you a bit more information on when it is a good idea to seek treatment. So the first one to understand is that pregnancy and childbirth automatically puts us at a higher risk of pelvic floor dysfunction. By no means does this absolutely for certain mean because you've had a baby, you have a dysfunctional pelvic floor. Again, it just means that we're at a higher risk. So for example, especially if you had a difficult labor and delivery, tearing of the perineum, a C-section where obviously there's quite a bit of scarring that occurs, it's a great idea to get checked out by a physical therapist just to make sure those tissues are healing well and functioning normally. So the second one is that you're having pain during sex. So this can be an indicator that perhaps the organs are not sitting exactly where we want them to sit, or just that there's some tightness in the pelvic floor that just needs to be released, just like a trigger point that you would release on your glute. So it can be really simple stuff that you go in for one treatment for and things feel 100% better. Thirdly, you might be having some low back pain or pelvic pain, especially if you notice this during or after an exercise session, so pay attention to that. Also, diastasis recti, if you have an abdominal separation that isn't healing well, this could be an indicator that there's some relationship between the pelvic floor and your core that isn't quite working on cue. So we know that the pelvic floor muscles and our core function, so especially our abdominal muscle function, are intimately connected. So we would probably look to the pelvic floor to make sure everything is good there first. So also any incontinence whatsoever, any involuntary leaking of urine, gas, feces, those are indicators that we definitely need to get an internal exam to see what's happening in the pelvic floor. And remember, any amount at any time. So this could be a couple of drops if you're doing some box jumps or a heavy deadlift, or this could be fully wetting yourself. Either way, great idea to get this looked into a bit more. And then lastly, prolapse is a bit more severe of a case that we definitely want to get that looked into. So prolapse can feel like downward heavy pressure in the pelvis. It can be a bit difficult to describe for some women, but that's usually the most likely scenario of what they will say, that it'll feel like downward heavy pressure. You might feel like something is falling out of the body. So this is really just that our pelvic organs, the bladder, the uterus, the rectum for us as women, start to droop or fall out of place. So this could be the bladder falling back in towards the vagina, the uterus just falling down slightly, or it could be down and out of the vagina. So again, just some things to be aware of, and if you are experiencing any of these things, great idea to see a pelvic floor physiotherapist just to get it checked out for peace of mind, and you'll be back on your way to good health before you know it. Alright, so that's pelvic floor dysfunction, and hopefully that has helped you out today.